Hello, everyone. Welcome to National Government Services YouTube videos. And today's video, we're going to talk about Caregiver Training Services. If you were not aware, Caregiver Training Services is one of the new items added to the Medicare benefit by CMS for 2024. So CMS has finalized this proposal to add caregiver training services so that Medicare may make payment to practitioners when they train caregivers that are supporting patients with certain diseases or illnesses, such as dementia, as an example, in helping them to carry out the treatment plan for that beneficiary. So sometimes a patient may require ongoing treatment and not necessarily interaction with the physician or the practitioner. And that's where caregivers come into play, and caregivers create and provide that vital service to the patient. So now caregiver training will be paid as a benefit as well. Okay, Medicare will pay for these services when they are furnished by a physician or a non-physician practitioner who, in this instance with caregiver training, is considered a nurse practitioner, a clinical nurse specialist, a certified nurse midwife, a physician assistant, or a clinical psychologist. Or also included in the definition for caregiver training are therapists, such as physical therapy, occupational therapy, and speech-language pathology. So any of these practitioners can provide the caregiver training as part of that patient's individualized treatment plan or their therapy plan of care in the instance of therapy. This action is consistent with an executive order on increasing access to high-quality care and supporting caregivers. CMS feels it will help to support care for persons with Medicare by better training their caregivers that are providing those care for them. CMS has stated that they believe in certain circumstances, caregivers can play a key role in developing and carrying out the treatment plan, or, as applicable to therapy services, the therapy plan of care. As we mentioned, and as you see on this screen, the practitioners that are involved in providing that training to the caregiver. Now, one additional thing we'll touch on is what CMS defines as a caregiver. And CMS did provide a definition for a caregiver in the 2024 Physician Fee Schedule Final Rule, and that is an adult family member or other individual who has a significant relationship with and who provides a broad range of assistance to an individual with chronic or other health condition, disability, or functional limitation, and a family member, a friend, or a neighbor who provides unpaid assistance to a person with a chronic illness or a disabling condition. So we've talked about what is caregiver treatment. Let's talk about some coding for the caregiver training services. 97550 and 97551 have been added for coverage and consideration for individual training of caregivers for individual patients. 97550, as you can see on the screen, is for caregiver training face-to-face, initial 30 minutes of service. And then 97551, we see the add-on code for each additional 15 minutes of service. So the volume and frequency of caregiver training sessions by the treating practitioners for the same patient may be based on the treatment plan as well as any changes in the patient's condition, diagnosis, or the patient's caregiver as well. So we see these two codes, we see that they are timed, and that is for individual caregiver training services for individual beneficiaries. The next group of codes that we have is for group training services. So 96202 and 96203 is for that group training and behavior management or modification of patients with a mental or physical health diagnosis. Now, these group training codes would include caregivers of different patients. More than one caregiver or patient can be in the training. So this is, as it says, a group setting. 96202 and 96203 are defined as services provided by a physician or other qualified healthcare professional. The third code that we see on this screen is 97552. And this is for group training of multiple sets of caregivers who are caring for different patients. That group training code is not assigned a time, as you will see. So more than one caregiver trained at the same session must be billed under the group code, because the treating practitioner's time should not be counted multiple times for reporting to Medicare of coverage. The next thing to consider is that caregiver training services need to be congruent with the treatment plan. That is a key to this benefit. As I mentioned, it can be paid to one or more caregivers when the treating physician identifies a need. CMS believes with adding this benefit, it would be important to make the patient aware, out of a concern for their privacy, that the service is furnished outside of their presence, and any applicable cost sharing would be their responsibility. In cases of an Alzheimer's or dementia diagnosis patient, CMS encourages providers to obtain consent from the patient or their representative for caregiver training services as early as possible in the diagnosis so that they are aware. In adding caregiver training services, CMS has added this as a benefit to the plan, but they have not addressed things such as quality standards, teaching methods that are to be used, or any additional requirements. And those types of things we may see in future rulemaking. CMS holds the right to make those kinds of updates in the future as they see this benefit progress and how it's used. So conditions that may apply for caregiver training services include, but certainly are not limited to, stroke, traumatic brain injury, or TBI, various forms of dementia, autism spectrum disorders, individuals that have other intellectual or cognitive disabilities, physical mobility limitations, or any necessary use of assisted devices or mobility aids by the patient. Those are all just examples of things that may involve caregiver training services and meet the definition of this benefit, for which you may bill for the training you're providing to those patients' caregivers. So we hope you found this information helpful. We thank you for listening to our video on caregiver training services, and we hope you come back to visit us again and view our other recordings on various topics throughout the Medicare program. Thank you all for your time. Thank you for your consideration, and we will talk to you all again soon. Everyone have a good day.